Hey Miller Forward goers, I am here just wanting to bring you through the code cart and everything that it has in it. We are working with a demo code cart and Edna is over here supervising. So atop of the code cart, as we all know, we have our beautiful airway box. Did you know that on the back side of the airway box is everything that is included in here, which is super neat. Never knew this before. Everything that you can need in here in terms of airway supplies. This is a kind reminder, just goes at the patient's head of the bed. There is a super sucker. It's called the Big Chunk. No joke, right here. This is just a super hybrid Yankauer device that is in every airway box now. Also, atop of the code cart, we have this amazing reference book. This is standardized throughout the hospital. Inside, it's going to bring you right to all of your algorithms, your ACLS algorithms. This should be in the hands of the code leader at all times, following the algorithm that is appropriate for the patient condition at that moment in time. At the back of this binder as well, find it here, is a detailed and colored list of all of the drawers. So if you're new and unfamiliar with the code cart, you can always have a buddy standing next to you, helping you to kind of maneuver your way through and find exactly what the code team needs in that situation. Also atop of the code cart here, we have our beautiful recorder device, or recorder sheet, excuse me. These are new and they will go live on June 1st. Hooray! We, of course, have our oxygen setup and our suction setup as well. As a kind reminder, we do need the key to crack this tank open. This is a demo key, so you're not going to hear that hissing sound, but as soon as you crack this tank open, it will kind of start to hiss at you. You can regulate your suction canister here and then your O2 as well. So let's dive into the code cart itself. So within your first drawer, in the event of emergency, we are going to be pulling off this purple zip tie that is locked here, which will indicate that the code cart is fully stocked and ready to use. So in our first drawer, we have all of our first line ACLS medications here. We have our epinephrine, our atropine, our lidocaine, our dextrose, our sodium bicarb, our calcium, and our naloxone kit here as well. You just need to apply the nasal trumpet to the vial. And our amiodarone bolus, if and when we need it. Again, as a reminder, as we open up these first line medications, oh, that was a bad one. As we open up these first line medications, you are going to pop the tops off from both of these, and then these screw together. The yellow cap comes off the top, and that is easily injectable into an IV. Moving down to our second drawer here, these are all of our second line medications. We do have all the medications in the vial form, plenty of flushes, syringes, needles, caps. We have a random albuterol in here as well. I just want to pause here and take a moment to bring your attention to the epinephrine anaphylaxis kit. I know it's in big, bold letters here, but as a reminder again, this is for intramuscular use only. We will send our patient into a lethal arrhythmia if we give this through their IV. So this is for a patient who is anaphylaxing. Out of this demo code cart, we did eliminate our controlled here, our diazepam, but that will be in your code cart. Moving down, these are all of our IV medications. Again, just bringing your attention to a couple of items here. Our dobutamine and dopamine, they do live right next to each other. The coloring and the writing on these bags is meant to stand out to you. So dobutamine and dopamine, again, in a code situation and high stress, those can be easily mixed up. So just take a quick second glance. Your norepi drip kit, this does require assembly. So accessing the vial there with your syringe and needle, and then injecting into this port right here. And then you're able to hang that bag. Some lidocaine in here. Your epinephrine and D5 kit is down here. magnesium, and then the baddest of them all, this is your intubation medication kit. This and the airway box, consider them a married couple. Of note, this does have controlled substances in it as well, needed for intubation. Sometimes anesthesiologists will bring their own medications to a code, but it's helpful to have this out if you are needing to intubate that patient. Moving on down here, we do have our IV fluids drawer, so our LR, this is supposed to be dextrose, our normal saline. We have plenty of primary and secondary tubing in here. This is where your rainbow lab kit is also located. This one's a little outdated, but it will have a current paper copy that you can just send to the lab after you get a rainbow set here. That way the lab knows to hold the vials of blood until there is an active order in Epic. Some random little things in here, some IVs. All right, moving down here. This, I want you to consider your sterile drawer. And so within it is everything sterile. This big kit on the side here, this is for a central line insertion, if that is needed and indicated in a code. Off to the side, you've got tons of sterile gauzes, you've got sterile gloves. You do also have your paracentesis kit as well in here. Some sterile flushes, so on and so forth. A new dressing change kit, some needleless connectors, stopcocks. I forgot to mention that within this drawer, the random thing that's in here and usually underneath the bags of fluids is an extra set of defibrillator pads as well. I know, a little random, but that's just where they live. And last but not least, I kind of call this your catch-all drawer, but catch-all drawer with a purpose. Your ambu bag is down here. It does require assembly. You have a non-rebreather mask. You have an extra suction attenuator in here. You also have what respiratory calls the bougie, which is an ET tube. A type of an ET tube. Also in here, just some random spattering of things. A deep suctioning kit, a flashlight for pupillary response. And I think that in whole is your code cart. Don't forget that around back is your backboard as well. This backboard is ideal, more so than the top of your bed here, but either is going to work fine to do those compressions. Thanks all, catch you soon.